I think what makes me the surgeon that I am is that I love what I do. Outside of family and hanging out with my two children, I love being in the operating room. I love being in clinic. I had a mentor in Dallas who we were doing fixing a fracture at about 3 in the morning at Children's Hospital, and it was about our 4th one in a row, and we were really tired and it was going well, and he stopped in the middle of the surgery and he said, do you realize how lucky you are that you get to do orthopedics? And I've taken that with me. That is something that I feel like every day I get a chance to get up and I get to do what I love, and it hopefully helps other people. Dr. Philippon is a pioneer in hip arthroscopy and has done more than anybody else in the world probably, and his attention to detail and techniques I try to apply to every case regardless of whether it's a hip surgery or not. I'll never forget, he told me at a dinner once that he said it's very, very hard to do a perfect surgery, and that's what you should shoot for every time, and it is something that I take with me into the operating room every time I go. With that goal in mind. So I think the interaction between physical therapist and physician, specifically orthopedic surgeon, is extremely important. It was one of the tenets of my fellowship in Colorado. When I was looking for a practice to join after my training, I really wanted an integrated practice where physical therapy and physicians were in the same office, and Texas Orthopedics offers that. I completed a sports medicine fellowship in Vail, Colorado that focused on hip, shoulder, and knee arthroscopy. I felt incredibly fortunate to have an opportunity to go there for a year. One, it's a nice place to visit and spend a year, but more specifically, my mentors there are some of the pioneers in sports medicine. Dr. Steadman moved there from Tahoe 20 years ago and created one of the best facilities in the country for treating orthopedic injuries, and he was joined later by Dr. Millett and Dr. Philippon, and then more recently by Dr. Laprade, and all of these names are big names in hip, shoulder, and knee. Specifically, Dr. Philippon is one of the pioneers in hip arthroscopy and has done probably more hip arthroscopies than anybody in the world. Dr. Laprade has written the book on multi-ligament knee injuries, and his scientific background as a PhD helped foster my interest in a lot of research, and so now that I'm in private practice in Austin, hopefully I can take some of the science and some of the clinical skills and apply it to my patients here. I think before undergoing a surgery, a patient should feel comfortable that they've exhausted all of their non-surgical options if appropriate. Certainly a shattered broken bone, there's not a lot of non-surgical options these days, and surgery is usually the best way to go. But for the weekend warrior who's got the aches and pains in the shoulder or the knee, that we're not jumping straight to a surgery or even straight to an MRI a lot of the times, that most of the time we can get things better by braces and injections and anti-inflammatories and physical therapy and activity modification, not necessarily stopping what you like to do, but maybe doing something that's a little bit different. So if running is what causes your pain, then and you're training for a marathon coming up, it doesn't mean you have to shut down the running necessarily, but oftentimes we do, and we have you cross-train and do some elliptical or swimming or biking or try to do something else to help keep you going towards your goal, even though we're treating an injury. So it always is tough when patients don't come in because they fear that they're going to be told not to do what they want to do. And then eventually, if we've exhausted those options and we get to the point that we're discussing a surgery, you should take the time, make sure all of the questions are answered. You understand your responsibilities as a patient after the surgery regarding therapy and time off from work potentially, or time off from activities. And sometimes we have to give patients the confidence that they can go back and do things when it's appropriate, and sometimes we have to rein in people who are trying to do too much too soon. And so I thought the physicians in the practice were excellent. The personalities were wonderful. There's multiple locations around the city, so it allowed easy access for patients all around the greater Austin area. The integration with physical therapy and the physicians in the same practice was really important for me, and I think those same things apply if I was to come here as a patient. I'd want to look for well-trained physicians who are caring, who have a lot of ties and experience to the Austin area.